Welcome to this explainer. We usually think of our health as something strictly individual, right? Like it's just about what you eat or hitting the gym or those trips to the doctor. But today, we're diving into a biological truth that's actually kind of mind-blowing. Our physical health is quite literally an emergent property of our societal structure. The data we're unpacking today tells a deeply interconnected and pretty fascinating story.
Here's how we're going to break this down today. 1. Inequality makes us sick. 2. The altruism antidote. 3. A tale of two societies. And finally, 4. How solidarity beat COVID-19. Let's get right into it.
Section 1. Inequality makes us sick. The cost of injustice.
Okay, so the source research reveals something absolutely startling. When a society fractures along economic or social lines, the breakdown of trust that follows doesn't just hurt feelings, it literally poisons the biology of everyone in that society. And I really want to hit the nail on the head here. This happens across all social strata. It's not just the marginalized who suffer. The entire environment basically becomes a biological hazard.
Look at this biological chain reaction. It's like a domino effect inside your body. Structural despair and inequality trigger chronic psychosocial stress. That constant stress essentially jams your body's alarm system, the HPA axis, in the on position. You're just stuck in this chronic fight-or-flight state. Over time, that nonstop panic physically breaks our bodies down into systemic inflammation. And, inflammation is the root cause of just so many chronic diseases today.
And the reason for all that chronic stress? It's the environment itself. Imagine trying to navigate a fractured world every single day, dealing with escalating criminality, a total lack of public safety, and just this pervasive social alienation. It acts as a massive depreciation factor on our bodies. People are practically pushed into finding desperate coping mechanisms, like substance abuse, just trying to self-medicate against the structural despair they're surrounded by.
To really back this up, we can look at the seminal research from Wilkinson and Pickett's book, The Spirit Level. They prove that this systemic friction demonstrably lowers life expectancies and drives up chronic illnesses for absolutely everyone involved. Seriously, if you live in a highly unequal society, your physical health takes a hit, even if you're sitting way up at the very top of the income bracket.
Furthermore, the extensive sociological data from Robert Putnam's famous work, Bowling Alone, anchors this perfectly. Basically, when community capital collapses and we become totally alienated from one another, our physical and mental health just collapses right along with it. So, if systemic inequality and isolation are the toxins, what exactly is the cure?
That brings us to Section 2, the altruism antidote, solving local problems.
According to the research, when communities organize locally to solve problems through mutual aid and shared civic responsibility, something kind of magical happens. Social justice goes from being just a piece of legislation to a daily practice. In that kind of environment, health actually stops being a commodity you just buy from a hospital. It becomes an emergent property of that caring social fabric.
Now, this is absolutely crucial. A deep sense of belonging actually triggers a literal biological shield. When we engage in community cohesion, our brains flood with prosocial neurochemistry, like oxytocin. This actively buffers against stress, it drastically lowers our allostatic load, which is basically the everyday wear and tear on our organs, and it promotes longevity. Altruism isn't just a nice concept, it's quite literally a medicine.
Section 3. A tale of two societies. Unequal versus altruistic.
When we look closely at their primary drivers, we see this incredibly stark contrast. On one hand, you have a society built on hyper-individualism, competition, and disparity. On the other, one built on reciprocity, social justice, and collective welfare. We're basically looking at two entirely different operating systems for human beings here.
And those foundational drivers, they directly dictate our psychological state. It's the difference between waking up every single day in a state of chronic anxiety and hypervigilance versus experiencing profound psychological safety, genuine purpose, and a real deep sense of belonging.
Ultimately, these contrasting states lead to completely opposite public health outcomes. The unequal society breeds depression, chronic disease, and lower life expectancy. Meanwhile, the altruistic society yields enhanced resilience, way lower chronic stress markers, and much higher life satisfaction. It just proves that community cohesion is deeply, deeply medical.
Which brings us to the climax of our explainer. It's one thing to look at these frameworks in theory, right? But what happens when they are put to the ultimate stress test?
Let's look at Section 4, How Solidarity Beat COVID-19, the Ultimate Stress Test.
The researchers noted that in highly polarized, fragmented societies, the traditional crisis response largely backfired during the pandemic. Top-down, authoritarian mandates and rigid lockouts didn't foster safety. Actually, scratch that, they did the exact opposite. They led to heightened isolation, skyrocketing rates of depression, and this incredibly deep distrust of institutions. In those fractured environments, even basic safety norms, like wearing a mask, became intensely politicized, breeding aggressive, confrontational behavior rather than mutual protection.
Conversely, the study highlights a striking contradiction that really challenged traditional Western epidemiological assumptions. Despite having immense population density, many Asian nations registered significantly fewer cases per capita than the global average. The secret wasn't stricter authoritarianism. No, it was the triumph of organic community solidarity.
Breaking down the different models, the fragmented societal response relies on heavy-handed mandates, which mostly just resulted in panic and defiance. But the cohesive model, that relies on organic organization and shared cultural values, resulting in highly effective transmission management and mutual care. Communities that manage the virus independently, driven by genuine concern for their neighbors, absolutely drastically outperformed the top-down models.
This success was driven by what the researchers call organic solidarity. In these highly cohesive regions, wearing a mask when you felt sick wasn't something that required police enforcement or some sweeping government decree. It was just an action driven by a pre-existing cultural tradition of respect. Because the community was already cohesive, taking steps to protect your neighbor was viewed as an act of social justice and love, completely disconnected from debates about personal liberty.
This data profoundly demonstrates the core thesis of our explainer today. The ultimate antidote to a systemic crisis is community-level altruism. When a society is cohesive, organization just happens organically, respect guides our actions, and public health naturally flourishes. And the best part, it does so at zero financial cost.
So I want to leave you with this final provocative thought to chew on. If the data is this clear, the community care, mutual respect, and altruism are quite literally the ultimate medicine for both our minds and our bodies, how do we start prescribing it? Think about how you might build human health through solidarity in your own community starting today. Thanks so much for joining me on this explainer, and I really hope this changes the way you look at the world around you.